Hi everyone. So about a year or so after I'd gotten sober, I started going to therapy. I sought out therapy because I just was having some really distressing symptoms, self-harm and some just like really intense depression. And I had uncovered some stuff by working the 12 steps that I wanted to look at deeper. Um, a lot of childhood stuff, parents' divorce, stuff that I never dealt with, that I always ran away from. So I found a therapist, and we found that we weren't a very good fit with each other, and she recommended me to another therapist. So when looking for a therapist, I just suggest that one think about what kind of therapy you're looking for. There's many different types. What I was doing was mostly cognitive behavioral therapy, and also we did a little bit of EMDR, which is eye movement desensitization and reprogramming, I believe, or reprocessing, which EMDR has been shown to be a really effective treatment for trauma. It works by really, like, if you have a wound, and there's something that's irritating the wound, like it's not going to heal. And it's the same thing with trauma. So trauma is like there's this wound and it's irritated and there's something blocking the healing. And so EMDR works by going in and like removing that blockage so that healing can happen. And it works really by reprogramming these memories that are really traumatic, going back to them and reprogramming them in a way that's not so intense. And it rewires your brain. It's amazing. There's tons of research out there that's available to look into. And I highly recommend that technique. So in looking for a therapist, think about what kind of therapy you're wanting, what type of therapist. I knew I wanted to work with a woman. I felt very unsafe around men. So I looked for a woman, and I worked with a woman for about 2 years. We worked together. I went about once a week. And I had to really learn how to just be patient in this process, because I went into therapy thinking I need to uncover all these memories. I could not remember my childhood before the age of 12, like very, very, very vague memories. And so I went into therapy with this idea that I was going to uncover all the memories of my childhood and go deep into the trauma, and we were just going to do it, and I was ready. And what I found in therapy is that it's been a very slow process, and this therapist and I really just worked on like taking an inventory of life, looking at family dynamics, and then really just working on tool building, because I didn't have any tools to deal with distressing emotions. Since I had been running and using drugs and disassociating, I never learned how to deal with painful things. I didn't have any like healthy coping tools. So what we needed to do first was work on those, and get a balanced and strong foundation, from which I could rely on when things were difficult. So we spent a lot of time just really like getting to know me and getting to know what works for me and what doesn't work and what feels good, and just building tools. So patience is so important during this process. Like what I've found is that everything has come up when it needs to come up, and there's no need to push and prod and dig. It comes when it needs to. And the most important thing for me at that time was just to really learn how to do self-care. So that's mostly what we focused on in therapy, and And yeah, I highly recommend looking into EMDR, and talk therapy can be helpful. But there's many different types. And if you need any help finding a therapist, please let me know, and I'd be happy to help you. Okay, thank you.